What are the pros and cons of supplemental versus antibiotic treatment?
You mean like herbal antibiotics versus
Yes, sorry.
pharmaceutical antibiotics?
Yep.
Well, the things to consider are basically cost, insurance coverage. If your insurance is covering the antibiotics, pharmaceutical, that makes them less expensive than the herbals. If you haven't to pay out of pocket for, say, Rifaximin, it's more expensive than the herbals. So cost, time, the one round of treatment for pharmaceuticals is 2 weeks, where it's 4 weeks for herbal antibiotics. They have equal effectiveness in terms of, success in treatment. It's just, it takes a little longer for the herbs to do the same thing that the antibiotics do in 2 weeks. In terms of microbiome damage, Rifaximin actually improves the microbiome. Neomycin and Metronidazole can harm the microbiome. These are, our main antibiotics we use. Nitazoxanide, I'm not up on its effects on the microbiome. I can't remember right now. Berberine harms the microbiome. Allison is thought not to. There's a debate about oregano. So there's, both categories have ones that can worsen or improve or not harm the microbiome. Other things to consider would be die-off. Herbs also kill yeast, fungus. So if you have yeast overgrowth, that's great in that it could also help that, but you could also get a worse reaction. We often see people have worse die-off on herbs, probably because there's yeast as well, and that's being killed. And then just general, like, how have you done with herbs in the past? How have you done with pharmaceuticals in the past? There are people who respond better to one category than another, and it's both ways. We see a lot of people with like MCAS and histamine sensitivity responding way better to the pharmaceuticals versus the herbs. The herbs have more histamine triggering. So, and then there are people who, anytime they take an antibiotic, they just feel awful and they only want natural. So that's pretty much it. Oh, and studies, they've all been studied. So there are more studies, of course, on pharmaceutical antibiotics. Clinically, obviously we've done before and after tests for however long I've been doing this, close to 15 years, no difference in efficacy.